talk a little bit about osteopathic management of the obstetrics patient. So far we had talked, yesterday about the idea of female infertility, top common causes. We went through kind of a case presentation where we had 3 women who had relative problems with infertility who went through osteopathic treatment. We talked about some of the similarities in those groups. We talked about some of the commonality of dysfunction, and then some of the commonality of the treatment that was applied, and then the hypothesis of, well, what might have happened that they then were able to get pregnant and then obviously go on to childbirth. So now what we're going to do is we're going to take a little closer look at what actually happens during the process of pregnancy. And we'll kind of break that down and talk about what is our potential role, or what potential roles might we play in this particular population. Because I think it's very important. You know, they say the best pediatric care is to the mother, right? The prenatal care, if you will. Getting the mother's structure and function correct so that ultimately when she has the baby, it's going to have a better start than if there's a twist in the pelvis or something along those lines. So what are some of the structural challenges of pregnancy? Well, these are the kind of 3 common things that are seen regularly. 1, postural curves, normally occurring postural curves are going to be accentuated, right? Second thing is that strain patterns will tend to be exacerbated. Whatever the person kind of has beforehand, oftentimes will just be augmented. Okay? And what's usually normally observed and or complained about, especially by the mother as the pregnancy progresses, is that there's an increased effort is required for just the normal activities of daily living. Just everything I do every day is more difficult. It's harder for me to do. So these are the 3 kind of common things that we see. Postural curves changing or accentuating, strain patterns exacerbating, and increased effort. What are some of the pregnancy-related changes? We have mechanical changes. In the mechanical changes, we're talking about changes within the musculoskeletal system, and particularly changes within the center of gravity, which may put more or less pressure in certain disc areas. So depending upon what was going on with the mother before she got pregnant, these problems may either be aggravated or in some cases actually alleviated, depending upon which way it works. Along with the structural changes go along the what? The functional changes, structure and function. The functional changes we say are the physiological changes. And one of the biggest things you see that you can kind of easily observe is the fact that there's an increase in the interstitial fluids, which we would say is edema. So there's like a swelling or a retention of fluid. Certainly there's many other things that take place during pregnancy. What's one of the other adaptations that occur, say, cardiovascularly during pregnancy? What happens to the mother's blood volume? Increase or decrease? Yeah, the blood volume increases, right? So therefore cardiac output will increase, right? So there's cardiovascular changes that take place. It's one simple adaptation. Usually there's an increase in muscle mass. Why is there an increase in muscle mass? Think of being pregnant as the original progressive resistance program.
Support the weight, to support the...
Yeah. As the baby grows and the mother gains more body weight, she physically has to carry that around. And assuming she doesn't greatly diminish her activity levels, her muscles are going to respond by what? Getting stronger and by hypertrophying to some extent. Okay, so there's 2 kind of real simple adaptations. From a lymphatic standpoint, there tends to be a decreased efficiency of fluid removal. Why might that be?
Well, the diaphragm is going to be...
Well, the diaphragm in the later stages of pregnancy starts to become compromised, which is a major pumping action, right? What else might happen?
Pressure changes.
Pressure changes because of the other transverse fascial planes, or diaphragms as we call them as well.
Compression,
right?
Major venous elements.
Compression in the venous elements, which ties into this. Venous problems, peripheral as well as central congestion. When we talk about central congestion, we're not talking necessarily about the periphery and the muscles of the extremities, but we're also talking about the organs, and we're also talking about what? Because of the curves in the spine changing, we talk about compression, relative venous compression of what? Venous plexus. The Batson's venous plexus within and around the spinal cord, right? So that becomes potentially an issue as pregnancy progresses. And then, of course, there are hormonal changes that occur, which are, one, a direct response to the growing fetus, right? They're the things that allow the changes to occur to allow the fetus to maintain viability. Right? That's one avenue which we talked a little bit about some of that yesterday. Right? What's some of the other things that happen, especially later on in the pregnancy?
Well, there's a relaxation of certain structures.
Right, hormone
especially
called
pelvic
relaxin,
area.
right?
Yeah.
Relaxin, which then causes musculoskeletal changes, particularly in the pelvis, right? It usually allows the spreading and a lateral movement of the pelvis for ultimately the aperture where the baby's going to come down through, allows that to start to soften and loosen and move. So sometimes in patients who started out with a lot of stiffness and pain or discomfort related to stiffness or height bone mobility, as they progress in their pregnancy, oftentimes that type of thing greatly improves. Women who have had a history of fibromyalgia, sometimes during pregnancy, will be like, I feel great. Because that hormone seems to counter some of the effects that have been present in their fibromyalgic kind of state where they have lots of aches and pains and feeling run down. So this hormonal change can cause a lot of alterations in the musculoskeletal and fluid changes. Not always a negative thing, sometimes a positive thing.